Hello and welcome. Thank you for joining us for this talk on World Wildlife Day 2026. I am going to give you a brief introduction to the Belize Wildlife and Referral Clinic, the Wildlife Ambassador Program, as well as One Health and how this relates to pest control. My name is Dr. Isabel, and I am the director at the BWRC. We are a wildlife rescue and teaching clinic. Our vision is wildlife conservation and sustainable development in cooperation. And our mission is to support wildlife conservation, animal welfare, and the veterinary profession through medical care research, collaboration, as well as education. What we do on a daily basis is we care for and rehabilitate injured, orphaned, neglected, or otherwise imperiled wildlife. We hope to be a voice for humane treatment of animals, and we provide environmental education for future generations. The Belize Wildlife and Referral Clinic was registered as a nonprofit in late 2011. We work under a memorandum of understanding with the Belize Forest Department. And again, we assist with rescue, rehabilitation, relocation, and education, as well as a 24/7 wildlife emergency hotline. We have by now treated about 7,000 wildlife patients as a charity. And of our injured patients, 70 to 80% of these injuries are directly or indirectly caused by humans. Why our work matters, again, many of our intakes at our wildlife hospital, 50% about, are victims of human-wildlife conflict. Of those, about 30% may be rescued on the roadside, and 30% are linked to illegal wildlife traffic, another big driver for intakes at our clinic. Many of the injuries we see are indeed caused by garbage, fear and myths, as well as illegal feeding, and of course, habitat loss for wildlife. So very important part of our work is the education as well as our 24/7 wildlife emergency hotline as keys to prevention. In 2018, we developed the now award-winning community-based training program called Wildlife Ambassador Program. And the goals for this program are to prevent wildlife conflict and crime, to improve the response to wildlife emergencies, to increase awareness of our national and international laws and guidelines, and ultimately to promote coexistence. Our ambassadors are trained in many things, including wildlife ID, non-lethal conflict resolution, zoonosis and prevention, safe response, and hotline use. So you can use this program now. It is grant funded and registration is available online. But what is this much mentioned human wildlife conflict, or we abbreviate as HWC? It's an interaction between humans and wildlife with negative consequences for one or both. This occurs when wildlife threatens human livelihoods or safety, and humans threaten wildlife survival and or feel bothered by wildlife at times. We have a long list of species. Common or high-profile conflict species would be jaguars, crocodiles, commonly snakes for just being in the wrong place, raptors, you will hear more about opossums and coatis, and many more. Many of these conflict species are indeed attracted to food sources that humans have provided, and they didn't even know. So there's much guidance on human wildlife conflict management, prevention, and mitigation. And we can provide you with further training, guidance, and a reading list too, if you're interested. These main causes for conflict are, again, number one, habitat loss, uncontained garbage, or purposeful feeding of wildlife, livestock that's unprotected out in the habitat or at night, myths and fears. And our biggest human caused attractant that then causes conflict is garbage, because garbage equals as food. So the root problem being the food sources humans provide purposefully or accidentally, including through improper waste management. This attracts rats, which will attract snakes, owls, coatis, and more, and then there is a conflict. The feeding and these food sources also encourage dependency on human food, and it increases aggression as well as the risk of disease spread. What's the solution? Simple as that: secure garbage bins, don't feed wildlife, and remove food waste. Close any access under houses and attics to avoid animals moving into walls or attics, which is another common issue. And prevention is always cheaper than treatment or mitigation. So what can you do? Educate yourself, don't feed, manage your garbage and food remains, and close any access to nesting space under houses or in attics. These are three common causes for conflict that could easily be changed with simple measures through knowledge and education, because most people just don't realize that they do have an animal house, hence a house that's inviting animals to move in for nice protected shelter to nest and raise their young. The importance of wildlife for natural pest control can't be overemphasized, and again, you will hear more about this later, but owls, snakes, and raptors are the best natural pest controllers. A single barn owl can eat many hundreds of rats per year, and of course, there are countless benefits: reducing crop losses, disease spread, and no need for rat poison. Protecting predators indeed protects farms and public health. The risks of rodenticides, rat poison use, are very large. There are many hidden dangers to wildlife. So poisoning rats also kills all the animals that may predate on these rats or scavenge on them, so including owls, hawks, vultures, of course, snakes, and even domestic pets. When secondary or primary poisoning occurs, so primary is if your dog accidentally eats rat poison directly, and secondary is when a predator or a pet eats an animal that has died of rat poisoning. They will show internal bleeding and suffer a slow, painful death. And removing these natural predators, of course, leads to ecosystem imbalance and even increasing rodent populations. So the much better alternative is to improve garbage control and habitat management instead of rodenticides. This brings me to briefly introducing what are we talking about when we talk about One Health. So One Health connects human, animal, and environmental health, and it recognizes that these three sectors are innately connected, whether we like animals or the environment or not. There are many crucial health links between us and both of the others. So one example given here, much repeated now, is we have garbage, which attracts rats, which then attracts snakes, which then causes conflict with humans who are then at risk of getting bit or getting diseases. The next example here for One Health is when habitat is destroyed, this stresses and displaces wildlife, which leads to increased disease spread, which again leads to increased risk for humans, bringing it all back to us. So protecting wildlife protects people is the key message. Zoonoses are one of the big topics under the One Health umbrella. Diseases shared between humans and animals. Key messages here, all of these topics are very big, and I could talk hours about each one. But key messages are that they are very prevalent, as in very common diseases that are transmitted from animals to humans and vice versa. And 60% of all infectious diseases that we humans get are indeed zoonotic. And even worse, 75% of emerging infectious diseases were also zoonotic. So a very large number of EIDs originated from animals before they caused diseases in humans. And why are we so concerned about emerging infectious diseases? Because they have the potential to turn into a pandemic. So zoonotic diseases can spread through bites and scratches, contact with saliva, feces or urine, and just plain handling sick wildlife or handling wildlife is a zoonotic disease risk. Examples of important zoonoses are rabies, leptospirosis, salmonella parasites. And again, the key message is never handle wildlife without proper training. It carries a huge risk for you and the animal. So there is an endless list of zoonotic diseases, and key message here, a slight stab, talk to your veterinarian because veterinarians have to study zoonotic diseases in vet school. And I cannot go into this list, but only encourage you, if you're interested, please find us online. We do have much more learning material on most of these diseases and zoonosis in general as well. So I want to emphasize the risk of inappropriate contact with conflict or sick wildlife and stress on these high risk situations for everybody involved. And that is touching baby animals, especially do not ever handle bats or approaching injured carnivores. Both of those carry a high rabies risk. And again, attempting to kill or relocate animals is a high risk situation that you should not engage in. The risks are to catch diseases, to be severely injured, and of course, there are also legal consequences because wildlife requires permits from the government. So, most important message, be safe, educate yourself, call our hotline at 615 5159. We recommend non-lethal conflict solutions. So the first step is always proper garbage management, removing any attractants for these conflict animals, closing access points to walls and attics, and then using deterrents, simple deterrents such as lights or noise, also fencing, and of course enclosures to protect livestock at night. Um, you can always call our hotline for advice and note that relocation is always last resort because we have to know why the animals are there, what's attracting them. If that stays there and we remove the animal, they will return. Killing is often illegal. Our wildlife species are protected. Um, our big goal as an organization is to prevent and mitigate wildlife conflict or crime, to decrease wildlife mortality and zoonosis risk for humans. And our preferred outcome for the victims is, as shown here, release. For you, when should you call us? Call us if you find wildlife that's injured or appears sick. If you find truly orphan babies, call us first because this is often mistaken. If you see a dangerous animal in your community or suspect wildlife crime, for example, this baby monkey here, that would be a crime because monkeys are not allowed as pets in Belize. You can call our hotline and we will connect you to help. We provide the support through the hotline, veterinary care. We collaborate with the authorities and we provide rehabilitation. And last but not least, call us to get training, become a certified wildlife ambassador. Our shared goal is to create coexistence between humans and wildlife, to reduce conflict and crime, as well as zoonosis risk for us, to protect biodiversity and to protect human health. Healthy wildlife equals healthy people and equals a healthy Belize. Once again, our hotline number. You can also find us on Facebook or Instagram. We create a lot of educational content there. Join our training program, also available in parts online, and there's our website. And this brings me to thank you so much for your attention, and any questions, please email.